Good morning. My name is Jennifer, and today we're going to be talking about in what ways do race and gender impact the diagnosis and treatment of mental illness. Disparities in healthcare are more common than people think. Racial inequalities in healthcare access and quality occur when people lack equal access due to income levels or the environment in which they live. One contributor to racial disparities with regard to mental illness is the lack of cultural competence and awareness with healthcare providers and clinicians. As mentioned by the National Library of Medicine, training is important to healthcare providers so they can begin to understand their unconscious bias, disparity awareness, and cultural competence. Providers need a good understanding of their beliefs because if they lack understanding of their contribution to the disparities, they lack to see themselves as part of the problem or being part of the solution with improving disparities. Another contributing factor to mental health disparities of racial, ethnic, and sexual minorities include cultural stigmas regarding mental health care, discrimination, and just a lack of awareness about mental health. Lack of cultural understanding by mental health providers can contribute to underdiagnosing or misdiagnosing mental illness in people from racially, ethnically diverse populations. Factors assisting to this include language differences between the patient and the provider, stigma of illnesses among minority groups, and cultural presentation of symptoms. This information was provided by the American Psychiatric Association. Also, people in racial and ethnic minority groups are less likely to seek mental health care for various reasons, such as they have a distrust in the healthcare system. Maybe they've already gone out seeking some kind of support before and they were turned away or not taken seriously. They may lack transportation to get to treatment or to continue with treatment, or they may lack insurance or lack of income, which sometimes if you don't have insurance, even though they're supposed to treat without insurance, you could still be turned away, which also could add to the distrust in the healthcare system. Lastly, society adds to the stigma of mental health treatment as it relates to gender. Typically, society has painted men to be the provider of their families and to not show weakness or emotionally. Generationally, young boys are taught not to cry or express themselves as it could be a sign of weakness. Depending on the man's cultural background, the expectations may change. When you have an intersection into a disparity, especially as it relates to gender and race, so like Black men in particularly, professionals and clinicians should work towards understanding what the cultural and society stigmas are to assist their client working through those barriers to access treatment. Lastly, many of these examples speak to a bigger system issue of just having plain equal access to treatment and care. As a whole, we have to work on changing the limitations to access for all, as the disparities can lead to shortened lifespans for ethnic and racial minority groups and have high risks of self-harm for men. Thank you.